Is that swelling a hematoma after surgery? After surgery, you might notice some swelling near the surgical site. But how can you tell if that swelling is a hematoma? A hematoma is a collection of blood outside of blood vessels. It usually happens due to bleeding under the skin or in tissues. When a hematoma forms, it often appears as a raised, swollen area. You might feel a firm lump beneath the skin. The color can change too, showing dark red, purple, or blue bruising. The skin around the hematoma may feel tender, warm, or even painful to touch. So, what are the signs that swelling could be a hematoma? First, look for swelling and lump formation near the surgical wound. If the discoloration looks darker and more raised than a typical bruise, that could be a clue. Pain or tenderness in the swollen area is another sign. Sometimes, blood may leak between skin sutures. This can cause visible bleeding or discoloration around the edges of the wound. You might also feel a sense of fullness or pressure in the area. If the swelling is near a joint or muscle, it may limit your movement and cause discomfort. It is important to differentiate a hematoma from other complications like seromas. Seromas are collections of clear fluid, and they usually feel softer and are less painful than hematomas. Hematomas can vary in size and severity. Small hematomas often resolve on their own within a few days. Your body gradually absorbs the pooled blood. However, larger hematomas may continue to grow, causing significant pain or increased swelling. In some cases, especially after surgeries in sensitive areas like the neck, a growing hematoma can compress nearby structures. This can become dangerous and requires prompt medical attention. If you notice that the hematoma is large, painful, or causing other symptoms, such as difficulty moving the affected area, you should seek medical evaluation. Worsening redness, warmth, or signs of infection, like fever, are also reasons to consult a healthcare provider. Treatment for a hematoma may involve draining it surgically. This helps remove the collected blood and prevents complications like infection or delayed wound healing. If you see swelling after surgery that is firm, painful, discolored, and possibly accompanied by a lump, it could be a hematoma. Monitoring the swelling and seeking medical advice promptly can help ensure proper management and recovery.